Hello, welcome Facebook Live viewers. Glad to have you on this Thursday. And I'm Dr. Bill Bird, Chief Medical Officer here at CGH Medical Center. Thanks for joining us. I'm excited to have with me today our Chief Executive Officer, Dr. Paul Steinke, who's going to join us and answer some questions of mine, as well as any questions that you have. So, Paul, welcome.
Happy to be here, Bill.
Yeah.
Hello, everyone. Good afternoon. It's a beautiful day out there.
Yeah, it is. It is. So, yeah, I've been wanting to get Paul on for a while, and it just worked out well this week with our schedules that he could jump on and take questions. So, as always, today, if you have questions, just send them our way, and we'll try our best during this broadcast to answer those. But while we're waiting for your questions, I'm going to start with mine. So Paul, first question that I thought of, I'm just curious what you thought about was, what are some of the things that have surprised you most during this pandemic?
Well, it's a long list, Bill.
Yeah.
I don't think any of us, we've talked about pandemics that come around every 100 years, and it was more of a curiosity and something to learn from in training, med school, and so on. I know in the last several years we talked about, hey, about every 100 years there's a pretty significant pandemic that hits the planet, and those are all in the theoretical. So I think the pandemic itself has been a surprise. I think that some of the challenges that have come up, and we've worked through each of them, but things like who would have thought we'd be in short supply of masks. When we started out, we had, I think initially 40,000 just regular masks. And before long, that was something that we began to talk about as something in short supply. And we've worked through all those challenges, but it's interesting the things that we end up walking through and dealing with.
Yeah.
And so I guess probably the thing that has surprised me the most are those things that come up, but also, and this is the positive upside of this, is how adaptive everyone is. Every time there's been things that have come up, both work related or outside of work, it seems like as human beings, we adapt. This thing that's going on right now is a good example. We wouldn't have this whole regular getting together with the Facebook community is one of those things that otherwise wouldn't have happened, and we wouldn't be doing it in this format.
Yeah, that's a great point. Yeah.
The fact that we've adapted and that we're all getting through it has been the positive side of that.
Yeah, folks wouldn't know about Bowtie Thursdays if we hadn't started doing this broadcast.
That's right.
So your answer segues into my next question, which is this. So what's impressed you about our staff here at CGH during this COVID pandemic, Paul?
Yeah, sure. So that's a good segue. I've all along I've felt our most valuable asset at the hospital has been our people, and that has just been reaffirmed and proven time and again, in particular through this pandemic. I am humbled and impressed how people have stepped up, worked hard, put everything into helping patients and getting us through it. And, from the time that we really encountered this, and it started back in March, all through that initial scary time where we really didn't have an idea of what we'd be dealing with, we settled into a little bit of just a regular lull through the summer. But then lately in this fall, and as we got into October and November, as the numbers have heated up, it's taken a lot of CGH employees out, and therefore left us a bare bones thin staff. But even with that, there's been people that step up every day. Yeah. They work 12 hours, 15 hours, 18 hours. They go home and get some sleep, say hello to their families, and then they come back and do it all over again. And the fact that they just keep going, and it really is a demonstration of their dedication to our patients that has really been impressive.
I'm wondering, any stories come to mind about how folks have risen to the occasion, either for patients, for families, or for each other during this time, Paul?
Oh boy, I got a ton of them.
Yeah, share those with us.
So early on, again, as we were working through shortages, it was a testament to thinking outside the box. Um, just within the community, we reached out to say, hey, we need X, Y, and Z. And I'll call out Wall Clipper on this. Early on, we recognized that one of the things we were really in short supply of were face shields. Wall Clipper in that moment made their engineering department available to us. And within a couple of days, we had a prototype and ended up with some face shields, courtesy of Wall Clipper. That's amazing. We had one of our nurses in CCU had some connections with a hardware store and got some N100 masks. And within a short amount of time, we bridged a gap with our ultra filtrating masks that we wouldn't have otherwise been able to do.
Yeah, that was a lifesaver.
But beyond that, on the personal level, like I said, just the last month, there's been just personal sacrifices that I'm aware of where people, again, work 12 hours, 15 hours, 18 hours. They go home, again, sleep 4 hours, and then come back. So,
yeah,
I mean, it's that kind of stuff that is, and that happens routinely, where people are trying to take care of each other and they're filling in, making sure that they're getting home to see their families, making sure that childcare issues are being addressed. Our people are really just pulling together in that regard.
Yeah, Paul, you alluded to this in your answer, this answer, but can you kind of speak to where we're at, where CGH is at as a hospital, in terms of being able to give our usual care to our patients, both here in the hospital as well as in our clinics, in light of the number of the recent surge and number of staff that are out due to COVID related issues?
Yeah, I mean, our focus hasn't changed. It's still about doing the best we can to take care of patients. And while the focus has been on COVID patients, COVID positive patients, heart attacks still happen, cancers still are discovered, and our efforts have been, again, focus on doing the best we can for those COVID patients, but also to make sure that when people come into the hospital or the clinics, that they feel safe and secure, that we're doing what we can to keep them from getting sick from COVID, and safe enough to not ignore the screening tests that still need to happen. You still need mammograms and colonoscopies and blood tests. You still need follow-up visits for your diabetes. You still need to come in. If you've got chest pains, those things still need to be addressed. So in terms of our focus hasn't changed. It's been expanded in terms of addressing COVID, but also making sure that our patients and our employees are safe from COVID so that we can do the other things as well.
Yeah. So it's we've talked about it's a fine line. So far, at least, we seem to be getting through that fine line, if you will, with taking care of the folks that show up and need our care, and we haven't had to restrict anything. That you say that's a fair statement right now?
Yeah. In fact, our challenge really is to keep it front and center, to remind people to don't ignore those other things. Without revealing any confidential things, we had a sad case just about a month ago of somebody who discovered a cancer too late. And I suspect and I wonder if that was somebody's hesitancy to come in and get the recommended screening colonoscopy and get that taken care of because of COVID. It breaks my heart when I hear things like that these are people that we actually could be seeing and treating and helping get past those things, but knowing that probably that delay happened because of COVID. And those are the COVID related problems that we don't probably spend enough talking about.
And even the little things that we think of as little, that on a population level can end up being really big. I just read a article this morning that mentioned, I think it's 9 million doses of vaccinations for children are not going to happen in 2020, which is about a 26% drop which over time could be as damaging as the pandemic in terms of
Sure. Right.
childhood illnesses. So we're open for business. We're still seeing folks. We still want to take care of those issues, and we're available to do that.
Well, and it's so much easier. You know this. We've been in family medicine a long time. It's so much easier to address something early on, and so much easier and cleaner to do it from a prevention standpoint than it is later on when it's advanced. And
Yeah,
that's
yeah,
what the shift is happening. We're trying to avoid that.
yeah. So obviously, staffing has been what we would call a pinch point in the last couple months. In the past, testing supplies, and PPE have been areas of concern. Where are we at right now in terms of our PPE supply and in terms of our testing, Paul?
Yeah, like I talked about earlier, when this first hit us in March, that was square one, was to figure out what our personal protective equipment supply cache looked like, what was our need going to be, and we quickly realized that we were at risk of being short, and that's what we were hearing from other hotspots like New York and
Yeah,
Seattle. So that early on, it forced us in the organization. You know, we always have kept a commitment to making sure our employees were going to be safe. So we got resourceful. Again, we looked at changing our protocols and so on, and we did a lot of things to decrease our utilization rates. We were fortunate that we never got to a point where things were out and we were doing reckless things. We thankfully we never had to get to that point like they did in New York and other stories.
yeah,
But what it required was having somebody with a daily count. How many masks do we have? How many gowns do we have? And Bill, you know this. You were part of it. We had meetings with the people that needed to be there to on a daily basis, and we would discuss the numbers and the utilization rate. And it was just a dogged pursuit of understanding what our supplies were, when they were coming in, what our use was.
yeah,
And from that, we again thought outside the box, secured other avenues of supply, and got us to a point where we today, and I don't want to jinx us, but today we feel like we're at a point where our supply chain is solid and our
mm,
supply cache is there that we can
yeah.
support our needs.
How
Obviously,
about on
that's
the how about on the testing side of things, Paul? How
yeah.
you
So
feel?
the testing has kind of followed a similar path with a little bit of a different outcome. Early on, we had some outside reference labs like LabCorp and so on. As all of this evolved and testing was brand new, those outside reference labs worked through their own um stopgaps and limiting factors and have stepped up. And so we have, at this point at the hospital, we have two methods of testing for COVID. Um, they're both PCR, which we know to be the most accurate way to test. PCR is polymerase chain reaction, and it looks for segments of DNA, RNA, and that is a very accurate test. So if it's positive, we can believe it. If it's negative, we can believe it, and that's what we use here. The supply early on, there was a what we call a point of care test, so we can actually do it at the bedside. We swab, it goes to lab, and within a half hour to an hour, we get a result back. We would prefer to be able to do all of them that way, where we get an instant result
Yeah,
within an hour. Unfortunately, the manufacturer of that test has not been able to keep up with the demand, and so it has forced us to look at our utilization of that rapid test, and we restricted its use to those that are having emergency surgery, those that are getting admitted to the hospital, those sorts of things. But unfortunately, we don't have enough of a supply to just do that for everyone.
yeah,
The other backup test is the one where we swab and it gets sent out to our reference lab, and they've been doing a good job of getting us a turnaround time that is within a couple of days. sometimes a little bit longer, sometimes a little bit less. But again, that is a PCR test, which means that the results are very, very accurate. But there is a lag, and that has kept up, and our supply of that has been solid, and that continues to be our primary source of testing. The rapid test is the one that continues to be in somewhat of a short supply, and so we've had to be careful with the way we use it, and we've deployed it in a way that ensures that our patients that come into the hospital are we know their status, and therefore we're better able to protect our employees.
Yeah. Yeah. One of the things that we talked about early on too was this whole idea that the pandemic forces you to do things that you didn't think you'd be doing. Can you talk a little bit about what we're doing for as we discharge patients from the hospital who have been treated for COVID? Some of the things that we're doing once they're discharged in terms of televisits and those type of things, Paul.
Yeah, things have kind of full circle. We've recognized that folks that end up with the COVID infection, thankfully, the vast majority of people do very, very well with it, and they don't even get sick enough to need to be in the hospital. Although I think it's rough at home on those folks that thankfully it's not sick enough to be in the hospital. But for those that do end up in the hospital, we're finding that it is a very stubborn and long convalescence. They're sick for a while. There's a point that a lot of folks hit where we feel that they're stable. They're not getting worse, but they're not getting better. And we continue to take care of them in the hospital, and we support them as long as we feel that is necessary. What we've recognized just more recently in the last several weeks is a lot of those folks do well at home. But to make sure that they are well and doing well at home, we've set up a televisit so that we have a nurse practitioner on the weekends that does a visit and checks on those people and says, "Hey, how you doing? How you feeling? You were with us a long time, and now you're home." And sometimes they might be on oxygen. It might have to do with some different medications they're on, but we have nurse practitioners then that will do a telehealth visit and check on them to make sure that they truly are continuing their long recovery. So that's been a good bridge between a long hospital stay and home.
Yeah. So we understand that some patients don't have the technology or aren't savvy enough with the technology to do a televisit. In that case, we're trying to do a phone call the next day with those patients, and then based upon how the patient's kind of clinically looks, then our PCP team is deciding whether they need to see the patient the next day or whether they can wait. And one other shout out that I think we want to give, Paul, is to the foundation. Can you kind of talk about what they've done to help those discharged patients too?
Yeah, our CGH Health Foundation, they're always looking to help out where they can. This was, again, a bridge to getting people home. The thing that we worry about is really low oxygen levels, and there's a device called a pulse oximeter. It's something you put on your finger, and it can tell you whether your oxygen levels are normal or not. And so a need was recognized. We're going to bridge these people home, that we needed a way to know that they were oxygenating okay, that they were getting enough air. So these devices were recognized, and the foundation said, "Hey, we'll step up. We'll get 100 of these devices, and we'll help bridge that gap between hospital and home." And so as part of those follow-up visits, whether it be a telehealth visit or a phone call, the conversation is also, "Hey, how you doing?" But also, "What's your pulse ox showing? Are you keeping your oxygen levels up?" So the foundation has been instrumental in making that happen.
Yeah, that's been very nice for sure. So let's talk finances, Paul. So this pandemic has been rough. If you read anything, it talks across the country. This has been rough on hospitals and their finances. So how are we doing as far as our finances go, and kind of what things have we done to try to minimize the financial hit that COVID is causing to our hospital as well as others?
So again, our first priority is taking care of our people, taking care of our patients, taking care of our employees, and that has never wavered. The finances obviously are a support to that. No money, no mission is a cliche that is true. It's a cliche for a reason.
Yep.
When the coronavirus hit in March, in those early stages, because of the shortages in PPE, all elective surgeries were shut down. And that is primarily the impact financially to hospitals across the country. Um, we've already talked about the long-term health consequences of that, but on the financial side, it was responsible for a big hit. People stopped coming to the hospital, and I understand why. They weren't sure what they were walking into. Um, Physician offices closed down, and so all those things that keep our lights on and keep people paid, um, uh, they dried up. They stopped. Um, the the federal government stepped in, passed some legislation. There was some legislation called the CARES Act that ended up giving us some federal money to try to help fill that gap and keep us going, and that's been very helpful. As we have been able to secure PPE so that we knew our employees would be safe, so that we knew that people coming into our facilities were going to be safe. As we've been able to open things back up, those numbers have come back, and we're not quite up to the volumes that we were prior to COVID starting, but financially things are starting to come back. We have been blessed at CGH to have a strong balance sheet, and so that has helped us weather the storm, so to speak, and so we're getting through it okay. Some hospitals are on a shoestring budget, and any little thing that would offset that balance has really made it very difficult for them. And so,
Yeah.
Again, we're all seeing the same things and dealing with the same challenges financially. We're doing okay here at CGH because of our history of a strong balance sheet in the past.
Let's talk about something fairly positive. Let's talk about vaccines. So, tell me about what you're hearing about the vaccine situation right now.
Sure. I'm not an expert on vaccines. I'll tell you what I
Well,
know, but
we'll say you are for the purposes of our conversation today.
so to me at least, and this is the exciting part, I think that we are truly in the final stages of this pandemic, and the way forward is with a vaccine. If I have the ability to be the first in line and get a shot, and I can uh, take the handcuffs off and be free of this pandemic, I'll be there.
Yeah, me too.
So vaccines, through history, vaccines have probably done more for public health than any other measure that we've taken. It Unfortunately, they've gotten a black eye through the years, through unsubstantiated and unproven and more accusatory, defamatory things than anything else. I have always been a believer in vaccines. I don't just blindly follow what the manufacturers give us, but if you look at the hard science behind them, there is nothing better that has improved the human existence through the years than vaccines. So I know that the vaccine that comes related to COVID, it will not be released until it is proven to be safe. And the preliminary things that I've read are showing that it is very safe.
Yeah.
So across the world, there's about a dozen companies that are working on a COVID vaccine. It's interesting. Typically, with a vaccine, if you think about measles, chickenpox, and so on, the vaccines are typically put together where they change the virus, they attenuate it, they make it weak. It may even be dead. But it's about introducing to the human body an antigen that the body's immune system then sees that as a foreign invader, and it creates an immune response, and it prevents you from getting sick. So through the years, we've benefited. I mean, polio, my goodness, was an awful scourge, and
Yeah.
if it didn't kill, it left a lot of suffering in its wake. And now we don't even think about it. the vaccines that are out there, the ones that have been in the news more recently, are those that are manufactured by both Pfizer and Moderna. What's different about these vaccines is that instead of weakening the virus, it's a vaccine that actually uses messenger RNA. So when you look at pictures of the coronavirus and there's those little spiky things on the outside, what the messenger RNA is doing is it's tuning up the body's immune system to react to those spiky things. So unlike chickenpox or polio or other vaccines that introduced an attenuated, which would be a weakened or a dead virus, this the vaccines that Pfizer, Moderna, and others are putting out doesn't have the virus at all. It's getting the body's immune system to respond to those little spikes.
Yeah.
And so the chances of getting COVID from the vaccine are zero. It's the concern is that the body's immune response is what may cause some side effects.
Yeah.
The vaccines that Russia came out with and China came out with actually are using attenuated virus.
Oh, really? I didn't realize that. Okay.
Yeah. So their technology is different and their approval process is different.
Yeah.
And they're seeing that their response rates are in that 30 to 50% range.
Yeah.
The Moderna and Pfizer vaccines, the goal was to try to get a 50% response. They were, I think, pleasantly surprised that it's showing that it's a 95% response, which I take that again as very, very encouraging news.
Yeah.
And again, this is my preliminary read, and I am not a vaccine expert, but the side effects that I've seen reported are minimal, like fatigue. I think 3% of the people that got the Moderna vaccine had fatigue. 2% described a mild headache, but that was it. That was the extent of the side effects from the vaccine. So
yeah, I just read something this morning. I think it was about basically 10% of the folks will have some type of symptoms, mild symptoms, flu-like. Yeah, similar to the percentage of folks who get a shingle shot.
Right.
Yeah. So.
But the important thing to remember is that first of all, those things are limited.
Yeah.
They're not severe and significant. If you think about the possibility of getting COVID in the public, I'd rather have to deal a couple days with those symptoms with the vaccine and be set free from this than to be wondering if I'm going to end up with serious side effects from coronavirus itself.
Yeah.
And the other thing to remember is that the vaccines that are being developed for the Western side of the world don't have the full virus in them at all. So there's no way you can get coronavirus from the vaccine.
Right.
So.
Yeah, it's good. Another positive thing that we're hearing about in the news are what I call monoclonal antibodies, and there's a drug that the president received a month or two ago when he was ill, and it starts with a B. I can't pronounce the name of it, but so I'm not even going to try. But in terms of that monoclonal antibody, which is an infusion, an IV infusion that folks get, what are you hearing about it, and what's the status of that here at CGH, Paul?
Again, another light at the end of the tunnel, because obviously none of us wants to get sick, and the pathway out of that for the population at large is the vaccine. But this new monoclonal antibody that you're describing actually is providing the antibodies to fight off the infection itself. And so if you do end up sick, and I think right now that they are gearing it towards those that fit into a particular high risk group, there is help. It's as though we're getting your immune system a boost, and it's putting those antibodies into your body to fight the vaccine directly. Again, it's a new drug. It's been approved for use by the FDA for emergency use, and it's in limited supply. I think the state of Illinois, I heard, got 6,800 doses or something.
Right.
We've been told at CGH that we will get 50 doses, and it is a one-time infusion. So we're expecting that it will be more readily available in the near future, so that if somebody, again, fits in that high-risk category and they turn up positive, that there actually is some boost to their immune system to help them fight off the infection should it come to that. So
Yeah.
again, I asked you this the other day in a meeting, Bill, and I said, is this a game changer? And you said, yeah, I think based on what I've read about it, I think it is a game changer. So
Yeah.
between that monoclonal antibody and the vaccine, I think we're going to get through this sooner than maybe many of us anticipated.
I'm hopeful of that too, Paul. Yeah, and for the folks that are listening, and we'll listen to this later. Yeah, as that becomes available here at CGH, we'll be letting folks know about that. That's for
Yeah,
sure.
absolutely.
Yeah. So there's been a lot of chatter about the holidays and how to safely celebrate the holidays, and not wanting to make there be a bump after Thanksgiving or Christmas in terms of number of cases. So just on a personal note, Paul, in light of that, how are you planning on celebrating Thanksgiving? Let's just say with your family.
Well, it's tough, I have a mother in town and a sister in town and her family. My mom is I don't think she'll care. I'm sharing her age. She's 83 years old. She's going to be 84. She's in a high
Yeah.
risk. She's in a high risk category. I talk to her almost every day, and we've talked about Thanksgiving and Christmas coming up. She's terribly lonely, and it would be so easy to say, "Hey, let's all get together at Mom's and have Thanksgiving." Since we are so close to seeing this through, I would sure hate to think that we brought Mom something when within a month or two or three, we have a means to be done with this, and then we can all get together and have a holiday in January or February. And so that's really kind of what, as a family, we've talked about and stuck with.
Yeah.
It is so hard to have the holidays
It is.
happen and not get together. But I'd hate to not have Mom with us next year. So
Yeah. 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 My wife and I are going to celebrate the holiday, just the two of us, and probably do some type of Zoom call with our children and other family members. So that's kind of our different holiday this year, how it's going to be. So.
I know. I think my sister and I are going to end up bringing food to Mom, and we'll probably try to do something like this online and at least talk to everybody. And it's again, it gets back to my initial thing that we're adapting, and right now the holidays, I think, requires to adapt. There's a lot of shaming going on out there, and if I could reverse things and do anything differently through all this, first of all, I would remove the politics. It doesn't matter which side of the fence you're on, but if we could just make it a pure conversation about the pandemic and talk about the science behind it, and again, whatever side of the political spectrum you're on, I think is irrelevant. If we could remove the politics and talk about the pandemic, and then secondly, is to remove the shaming. I think there's been too much, somehow if you get sick, it's your fault. Somehow if the numbers are up, it's because the public isn't following the rules. I think there's some of that, but we've taken the approach here at the hospital to encourage personal responsibility. This is about all of us doing the things that we can do personally. Same things that everybody knows: masking, social distancing, avoiding crowds, hand washing. And I don't think we need anybody to tell us to do that. And, we all do the best we can. And it's really just about encouraging personal responsibility.
Yeah. Yeah. I agree. Hey, Matt, what was that question? Okay. Why is a COVID test recommended before any procedure? You want to take that one, Paul?
Sure. We know that when you're taking care of patients, you get close to them. So you have to be closer than 6 feet. When you're going to have a procedure, we don't know exactly what that procedure is, but more than likely, we're not going to be able to necessarily keep the patient masked up the entire time. There are some things, like if you're going to have surgery and have a tube down your throat to breathe for you, the things that are part of normal anesthesia, the 6 foot rule doesn't apply. And so the virus can float in the air further away, and it puts our employees at a greater risk. And so we started this a long time ago. We wanted to make sure that our employees were safe, and therefore other patients that come in after that procedure are safe as well. And so at CGH, we've gone down the path: if you're going to have a procedure here, you got to we want to know that you're COVID negative before you have that procedure.
Yeah. Yeah, I'm with you. Um, bed count. Um, it's better this week. You want to talk about that a little bit, Paul?
Yeah, I hesitate because I don't want to jinx us.
I know, I'm with you.
The last oh boy, 3-4 weeks have been a high water mark for CGH. We've been stretched to the gills, to the limits of what we can handle capacity wise. We've had days, nights where our CCU has been almost full, where we've been down to one bed maybe open. Our surgical floor, which is 2 East, we've had moments where that's been completely full and we've had to overflow into our medical floor, all with COVID patients. So that again, that's really been a high watermark for us in the last several weeks. And again, I don't want to jinx us, but the last 5 days, maybe a little less, we've seen some opening up of that and some diminishment in the numbers, and so we are not at that.
Cautiously optimistic. How would that be?
Yeah, there you go. We have not been at that near capacity level that we were seeing a week ago, all the way back to 2 or 3 weeks ago.
Right. But make no mistake about it, our numbers are way higher than they were back in the summer or March or that type of thing. What's the next? Are there any current resource, equipment, or financial constraints for CGAs local community and businesses can provide direct assistance with?
Yeah, I'll take this one too, Bill.
Okay.
And that's the other thing, I guess, that has surprised me. You asked me that the first question. What surprised me about this time? Um, and again, it's been humbling, but the level of community support has been overwhelming. And early on, our employees around here, there was always food available. Local restaurants would bring food by. They were supported routinely, regularly. And of course, understandably, that fell off in the summer. But now that the numbers have increased and the call's gone out, the food has started to come back. And I think people do what they feel that they know how to do. And it's food. We have people that come and there's prayer vigils in their cars. They've left some positive chalk messages that they draw on the sidewalk and on the parking lot. Those things all come together. Yeah. So Corey's asking if there's things that businesses can do, and I think it really is keep us in your prayers and your thoughts. The fact that you all are willing to step up and in some cases do what you're able to do has just been overwhelming and amazing, humbling.
Yeah, for sure. And if we do have anything that comes to mind, Paul, we can always post that on our website or Facebook pages so folks are aware of any other needs that pop up.
Yeah.
I wanted to talk just briefly too about any demographics that say occupations of COVID patients that's in the hospital.
Well, we are required to report to IDPH, Illinois Department of Public Health, which is they provide the rules and the guidelines that we have to operate under. We have to report our bed capacity to IDPH on a daily basis. In addition to the venues that I know that we talk about the number of inpatients, the number of folks that tested positive. There's a lot of communications out there in conjunction with the Whiteside County Health Department. We try to be as transparent about those things as we can be. I don't know if there's something out there that shows the bed capacity across the state or the country. I'm not familiar with that directly right now.
Yeah. Demographically, and then demographically, if I remember that question, I don't have it on the screen right now, but occupations, like what they do for a living. Anyhow, I don't know that we'd have what they do.
Oh, occupation. So they're asking what kind of work they do. I don't know that. That's a good question.
Yeah, I don't either. I would just say demographically, what you've read is true, is that it tends to skew more towards the sick, the elderly, those who have chronic diseases in terms of being hospitalized.
Right.
I wanted you to talk a little bit, Paul, about what we've been kind of thinking about in terms of some of our COVID patients. And I know we're not allowing visitors, but are we doing anything exception-wise as far as that goes? And what are we thinking about there?
I see another question on there. We'll get to that in a second. We can't forget our humanity. You know, our core at what we do is being kind and compassionate. We've had situations where, you're right, we restrict visitors, and I think it was Dr. Easington, one of our hospitalists, talked about one of his challenges was understanding that our COVID patients are lonely. He goes in to see them, and they want to talk. They crave that human interaction. To the extent that we're able, we have tried to do what we can to bring family in the room, and it may not be physically bringing them in the room. It may be getting them on an iPad and having a Zoom meeting like this with patients. And so we do what we can. We're not always able to make it smooth and easy, but we're trying to not leave the family out of the loop. We're trying to do what we can to support people's spiritual needs as well. End of life issues, when we get to a point where we've done all we can do and there's nothing more we can do, we will we'll do what we can to try to get family physically at the bedside with their loved ones to have some of those final moments together. Those are tough, but we're working through some of those issues. I think early on it was a hard, fast rule that if they were COVID positive, they were in strict isolation, even all the way to the end. But we're doing what we can to
kind of once again threading the needle there on safety for staff and for families as well as yeah.
And again, our staff, that's the part I think that is, among other things, that's the hardest part on them. I mean, we're used to dealing with people dying. That never gets to be routine. We had some moments in the last several weeks where you might have 3 to 5 people die overnight, and that's at a level that we've not experienced before, and that have taken a toll on people. The nurses that say, we're there, we're holding a hand, and we're sitting with people as they take their last breaths, and that impacts them. And if it didn't, I would worry. It just tells me that they care.
Yeah, that's right. I want to transition to one other a positive thing about our medical staff, Paul. So Dr. Ashley Kennedy was recognized yesterday, and you want to talk a little bit about that? And that was pretty cool.
Yeah, unfortunately, I had a conflict, and I was not able to be there to help present it to her. But she was presented with the Rural Health Hero Award.
There she is.
There's Dr. Kennedy.
It's a windmill. That makes sense for a Rural Health Award to get a windmill, right?
So Dr. Kennedy is one of our general surgeons, and the medical school up in Rockford has what they call an RMed program. And so there are medical students that actually rotate through CGH, and Dr. Kennedy is one of the teachers. And she was recognized in that regard as, I think this is a national award. I don't have that in front of me, but she was recognized for her teaching ability. And so that's kudos to Dr. Kennedy. She's a great surgeon and a good teacher, and that was recognized yesterday.
Yeah, she does a great job with those students. So that's a rural health tract up there in Rockford. That's part of why the connection with the Rural Award. So shout out to Dr. Kennedy. And we've had her on Facebook Live in the past, and she was a lot of fun to have on. So
congrats.
Hey, Paul, go ahead. I'm sorry.
I just said congrats, Dr. Kennedy.
Yeah. So we're getting to the end of our time, unless listeners have more questions. But I just wanted to give you a moment, Paul. Any final thoughts or words of encouragement for you want to give to the communities we serve and/or the staff that take care of those communities?
Sure. Let me answer that one question that we put off.
I'm sorry. Yeah.
Somebody had asked whether elective surgeries and procedures will continue. The governor's office did announce some heightened restrictions earlier in the week. It did not include stopping elective surgeries or other procedures. And so so far that's continuing. And a follow-up question to that was what would determine postponing them? When would we get to the point of doing that again? I think that as long as our overall, and I'm not just talking at CGH, but overall, as long as the PPE supply chain holds up and we're able to keep patients and employees safe, I think that I think they recognize that elective procedures need to continue.
Yeah. If you had the pillars, I think it'd be PPE, staffing, having adequate staffing to be able to take care of that. And of course, having the beds, particularly for inpatient procedures, to be able to do those. And right now, we're doing all right.
Yeah, as well as the testing.
Oh yeah. Yeah.
So to your final question though, Bill, let me end with this. I am excited. I am anxious. I'm anticipating good things, both from the monoclonal antibody treatments, because I think that is a game changer, and that's going to help us navigate this and get people through the infection. If they do get infected, I think it's going to change the outcomes dramatically.
Yeah.
But I'm all in for the vaccines, and to my core being, I've been in practice for 22 years, the last 7 years very part-time, but to my core being, I believe in vaccines. I believe in their safety, and I know that the vaccine that's coming with this will not be released if it's not safe. I've had lots of conversations with my mom. She's like, well, I don't know. And I'm like, Mom, you're going to get this vaccine because it's going to set us all free and it'll save your life. And I've looked at the way that it's made. I've looked at some of the data in the phase 3 trials. I'm not afraid of it. I'm looking forward to it. We're going to embrace it when it gets here, and it's going to get us through this. So there is light at the end of the tunnel, and I think it's right around the corner. So we have to bear down a few more months. We'll get through Thanksgiving and Christmas. But as we get into mid to late winter, I think we're going to see this break open, and the vaccine will be here, and we will all start to have some confidence that we're going to be through this. So we just need to get there.
Yeah. Good. Well, hey, Paul, it was great having you on and having you get you a chance to answer some questions for our community. And thank you so much. And also for those of you who've been listening, thank you for your kind words. As we've been talking, we're seeing those on the screen, and that means a lot to us. So
can I say one more thing, Bill?
What's that, Paul?
Can I say a parting thing here?
Yeah, go for it.
I want to thank our employees. I know that it gets cliche maybe, but I hope the public understands the dedication that the CGH employees have to CGH and to the community, because that is what is the game changer, and that's what's making a difference. Incredible people, and I can't thank them enough.
Yeah.
And second to that then is, and again, I was surprised by this, has been the support and outpouring of love from the community. So thank you to employees, thank you to the community, and I'll leave it there, Bill.
Yeah, I wholeheartedly agree with that, Paul. Thanks. And for those of you who are listen to us, I think next Thursday might be a holiday, so I don't have plans of doing Facebook Live on the holiday. So we'll catch up with you, unless you want to do it with me again here, Paul.
It's our meeting.
We'll plan on circling back and having a broadcast the following Thursday. So until then, stay safe. Thanks for listening. Take care.